Yeah, so the first thing is that you are among friends. 4 out of 5 people will have back pain at some time in their life, and at any one time, 1 in 5 people are experiencing back pain. So it's extremely common, which can be reassuring for people, of course.
My advice to people who are worried about their back pain is that I would probably worry if I didn't have back pain. Because remember, 80% of society are going to have back pain, so you're one of the normal, everyday people. It is not pleasant, and it's something that you're going to have to deal with, but it doesn't stop you doing anything you want to do as far as your work and recreational activity.
For the large majority of people with back pain, it's actually not possible to pinpoint the exact tissue or cause of the pain. But we still have very effective treatments that we can give to improve the condition.
Treatment for low back pain does vary according to whether it's acute or chronic. So in the first instance with acute pain, time is very much on the person's side, in that there's a lot of healing that happens naturally just as nature takes its course.
A lot of people who have back pain manage it themselves and don't need to seek health care. So the key there though is that as you're managing it yourself, that you are doing things that are helping your recovery and not hindering your recovery. So things like bed rest and avoiding work and not getting back to their usual activities can actually slow the recovery of back pain. So it's important to be as active as you possibly can. Even though you have pain, you want to try and get back to your normal activities as quickly as you can, whether that's work or home duties or whatever it may be that you normally do. And the key thing is that you may not be able to do your activities to your fullest extent, to your full capacity. So you want to have a gradual return to those activities to the best of your capacity.
For somebody who's experiencing their first episode of low back pain, I'd recommend that they rest, but not too much. So maybe for a day or so, just reduce the amount of activity that you do. Maybe you don't sit quite so long, a little bit longer periods of time lying down, walking, maybe even walking in water, going for a swim, but most of all, not to be fearful to move.
So by just stopping doing everything, you're actually deconditioning yourself and maybe actually contributing to the next recurrence of pain.
And I think fear is one of the greatest complicating factors in back pain. And if you can be mindful of the fact that the chances are it's going to get better. This is a little blip on the horizon. Just take care of yourself. Try and identify some things that might be aggravating your pain at that time and avoid doing those activities. Take some basic pain relief. Use ice or heat, whatever is most comfortable for you.
Don't let back pain stop you doing anything you want to do. What you have got to do is maybe do it more intelligently than you've done it before.
Perhaps some hands-on physiotherapy may be helpful in that short term. There can be a role for manipulation of the spine in the short term. There can be a role for medication use in that time frame as well.
In terms of going to see a health professional, I don't think it's necessary to do it at the first sign of low back pain. I think that with some of the strategies we've talked about earlier or you've heard about earlier, you'll be able to manage your low back pain. If it becomes persistent or if it's acute to the point that it is actually impacting and stopping you from doing what you want to do, then that is the time to seek some advice.
It'll take a week, 10 days to really start settling down. And if you find after a week or 10 days that you're getting no improvement in your back, or in fact you think your back is getting worse, then it's time to see a health professional such as a physiotherapist.
And in certain situations where there is evidence as the doctor talks to the person or examines them, there can be evidence that there may be some harmful underlying conditions. For example, if someone has a nerve-associated pain or nerve-related pain, sciatica running down their leg, there may be a case to get some investigations done in the first instance. This is the red flag issue, as we call it. in the medical terminology. So that's all about treating the acute episode, but mostly if people keep active and stay mentally positive, most acute back pain will settle over time.